Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institute. Subscribe our channel. And again, today we are talking about speaking. We have talked a lot about speaking, to be honest, and it's the easiest module when it comes to OET. But yeah, discussing it again is not a bad idea because sometimes we don't prepare it that much because we think it's easy. So again, like just now you have asked me that what is the pattern of speaking. So again, pattern of speaking is very simple. Just like the normal speaking, actually, the part of OET speaking is actually like what you will do if you are a foreign registered nurse, like sitting in UK or sitting on any other country like Australia, and maybe you are sitting in Canada or whatever. How would you take the patient? So that's exactly the role play when it comes to speaking. So first of all, you will listen to the symptoms. ऐसे ही होगा ना, patient will tell the symptoms first. So now the question is how to ask the symptom. So you will ask, okay, hi, my name is this. My name is Bhupesh. I am a nurse over here. Hi, my name is Bhupesh. My name is Bhupesh. I am a nurse over here. How may I help you? That is the first thing you will always do. How may I help you? This is the time when you are there, when you are there in a hospital and somebody comes to you. If the patient is already in a hospital, then that is a smooth transition. Patient is already in a hospital, you are going to the bed of the patient. So obviously you would like to confirm the name first. That is the thing. Confirm the name. That is the best way. Even if the name is given or name is given, you can have a hypothetical name. Hypothetical name means you can guess. मतलब you can make your own name. So you say, good morning. My name is Bhupesh. I am your nurse for the day. So, first of all, I would like to confirm your name. That is the way to start. This is the best way. Is your name Mr. John? If it is female, you can say Mrs. Maria or Miss Maria. Is your name Miss Maria? So the patient will say yes. Okay, then Mr. John. Um, Now I will, whatever the task is. Suppose if the task is patient had diabetic complication. So Mr. John, I can see from your notes that you are having diabetes, and now and yesterday you were admitted, or 3 days ago you were admitted due to complication of diabetes. Am I right? Now this is the way to ask. Am I right? Then patient will again confirm. Yes, nurse, you are right. Okay, then Mr. John. So yesterday you had your test. Now according to the task, yesterday you had your test. You had your test, and according to that, and now I have got your reports. So should I tell you about your reports? That is how you ask. Means please again listen to it again and again. Should I tell you about your reports? That is how you start the task. So there are three kind of tasks when you are starting. One, when patient is coming to you in the hospital, simple. Good morning, my name is Bhupesh. I am a nurse over here. How may I help you? If you are going to the patient's bed, good morning, my name is Bhupesh. I'm a nurse. I'm your nurse for the day. So as I can see, is your name Mr. John? Yes, nurse. Okay, Mr. John. As I can see from your notes that you are having this and this problem, and now you are waiting for your results. Am I right? Yes. Okay. So should I tell you about your results? Yes, nurse. Of course. Okay. Then according to your reports, you are having this and this problem. Simple. Third condition is third condition is first done, second done. Third condition may be when you are going to the patient's home. This is also an interesting scenario. Then you say, good morning, my name is Bhupesh, and I have been sent by your doctor regarding your diabetes. So first of all, I would like to confirm your name again. अगर आप किसी के घर जा रहे हो, if you're going to somebody's house, what can you do first? First, I would like to confirm your name. He will say, Mr. John. Okay, great, Mr. John. So, um, as your doctor has told me that you are having this and this problem. Simple. Then these are the way of starting the OET role play. So good morning, my name is Bhupesh. I am a nurse and I have been sent by your doctor regarding your diabetes. So before I tell you everything about it, because in foreign privacy is very important. So before I tell you or ask you anything about it, could you confirm your name, please? My name is your name Mr. John? Otherwise, patient will say my name is Mr. My name is John. Okay, Mr. John. So I'm at the right place. So I would like to tell you that your doctor has sent me because you are having diabetes and now your diabetes is out of control. Basically, you have not been able to control your diabetes even after doing diet management. Am I right? So you initiate the role, and in this part only, you can conserve your B secure, a B marks. Sorry, you can secure your B grade in OET. Means when you take the initiative to speak such good lines in the start, first impression is the last impression. Then second, obviously, so I should make a separate video, but okay, I will try to cover. I hope you find this video interesting and should continue. So second part, obviously, you will ask questions normally. Suppose if patient had an accident, so you will ask, how did this happen? So most of the questions go in did and do. Do you ask present questions? Do you smoke? Do you drink? Do you go to park? Do you exercise? Do you have any other symptom? Do you have any problem? Please write it. Listen to it again. I'm not writing everything because I want you to write it yourself. Do you smoke? Do you drink? Do you have any family history? Do you have any past medical history related to the same condition? Do you have any family history related to the same condition? Do you exercise? Do you smoke? How many cigarettes do you smoke? How much do you drink? These are the do wala questions. Did, if there is accident, how did it happen? When did it happen? And did it hurt? Okay, what then again different kind of questions. Then there can be other questions. Have you been ever hospitalized before? If you want to ask about previous, or otherwise, do you have any previous hospitalization? Do is the easiest thing. Do you smoke? Do you drink? Do you have any previous hospitalization? Do you do this? Do you have past medical history related to the condition? Do you have any family history? That's simple. Okay. And did, when did it happen? How did it happen? Whenever you want to ask, did will always come with the first form. Do to obviously will come with the first form. Did will also come with the first form. How did it happen? When did it happen? Third round is always about investigation if you want, or clinical examination. Clinical examination is the third round. You will say, I would like to examine you. May I? So you take the permission of the patient. Then you say, after examination, I have found. This is the third round that you are having. Whenever you are doing examination, this line will always fit in. I would like to examine you. May I? And how do you transit from question to this? Okay, thank you for answering my questions. I have noted down all your medical history and past history and all the relevant history. Otherwise, thank you for answering the questions. I have noted down all the relevant history. Now, I would like to examine you. May I? Okay, thank you very much. After examination, I have found that you are having this and this problem. Khatam. Then you talk about the treatment part. Treatment part mostly would go in, you need to do this thing. It's important for you. Also, it is advised that you should take rest. This is a very nice way of telling. Also, it is advised, passive voice. It is advised by us, by doctors and nurses. Also, it is advised to take rest, to do this and this, to take your medications on time. Further, taking PCM or any medication on time will be very beneficial. It will help in quick recovery. So you can talk about all these things when you're giving about advice. Most important thing is ending the role play. Ending the role play means you will say, now I would like to summarize the key points. So always summarize the key points. So now I would like to summarize the key points. Okay. So you can say, you can just summarize. So now I would like to summarize the key points that you are having this and this problem. and I have suggested you for this and this treatment, and I reassure you, if you follow these instructions, your condition will improve. That is how you end. Further, I would like to give you a pamphlet or a leaflet. It contains all the information what we have discussed. Please follow these instructions. It will help you in speedy recovery. दोबारा सुनो प्लीज, अभी दोबारा सुनो, पॉज करके दोबारा सुनो एंडिंग. I would like to summarize the key points and would like to reassure you that if you follow these instructions, you will be fine. Also, I'm giving you this instruction. All the instructions are given in the written form. Please go through these instructions. If you have any doubt, you can always contact us. And these instructions will help you in speedy recovery. That is how OET normally speaking goes. Again, I will revise it for you. Listening to the symptoms, asking questions. Do you have any other symptoms? Can you confirm your name? I have come here. So there are different ways of starting the role play. That is what we have covered. Then we covered how to ask question. How did it happen? Do you smoke? Do you drink? Do you have any previous medical history? Then we talked about examination. Then we talked about giving advices, whether investigation or treatments, and then ending the role play. That is summarizing the task and handing over the leaflet. When the patient is in the hospital, you don't have to give the leaflet, but you can summarize. Overall, I would like to summarize that now you are going to be fine. Doctor has already given you the treatment. Now you need to take the rest in the hospital, and the doctor will come soon and will also explain you the things. Now you can take rest, and there is a buzzer beside your bed. You can press the buzzer if you need anything. So if the patient is in hospital, you said there is a buzzer beside your bed and you can press the buzzer if you need anything. That's it. Doctor is coming on the round. He will also come to you. And if you would have any problem, you can ask the doctor as well. So that is how you reassure the patient that everything is fine. This is Dr. Bhupesh again, talking about speaking. Subscribe our channel. And again, don't do everything in one day, but whatever you do it nicely. Like if we have covered speaking, listen to this speaking 3 times. Again, you will learn so many things. Even if you know this much of speaking, obviously it will help you to get B grade because you get in sequence symptoms, questions, signs, examination. Clinical examination will tell you the signs, investigation, treatment, summarization, ending the role play. That's it. Thank you very much.